Have you ever felt confident about a topic until the exam asked you, draw and label the diagram? That's where most students struggle, not with understanding but with connecting diagrams and theory. Welcome back to Pharma Palette. In today's video, we are going to learn the anatomy of ear in a very practical way. First, we will draw the ear diagram step by step. Then we will keep the diagram in front of us and write the anatomical points directly from it. In this way, you are not memorizing randomly, you are linking the diagram with the notes so both stay in your mind during exams. So grab a pen and paper, let's start building the anatomy in a smart way. So first we have drawn the external part of the ear. So the above part we call it as helix, lower part is the lobule, both together we'll call it as auricle. This long tube-like portion we will be calling it as the external auditory canal. And in this external auditory canal, we will be having the ear wax. So this ear wax, it can also be called as cerumen. And here there will be one important portion which is called as the eardrum. So eardrum is also called as the tympanic membrane. Eardrum is also called as tympanic membrane. So from here, this is mainly having out of it, there is a temporal bone. So this eardrum is again connected with three important auditory vesicles. The malleus, this bone is called as incus. This bone we will be calling it as the stapes. This we will be calling it as cochlea. This is external auditory canal. This will be internal auditory canal. And here there are the presence of certain nerves, especially here. So this is called as the cochlear branch. This is called as vestibular branch. So both cochlear and vestibular together we will be calling it as vestibulocochlear nerve, which is the seventh nerve. And this opening, there will be two windows present. This stapes is called as the oval window, whereas this depression we will be calling it as the round window. And this round window, this is covered by the secondary eardrum or the secondary tympanic membrane. So this portion we will be calling it as, it will be again connecting to the nasopharynx. So this tube we will be calling it as auditory tube. And here there will be the presence of certain cartilage, which will be calling it as elastic cartilage. Especially in this area there will be presence of one muscle. That muscle we will be calling it as tympani muscle, and at this position we will be having one more muscle. That muscle we will be calling it as stapedius muscle. We will discuss about this in detail in the next few minutes. So this is the complete diagram of the ear. Now let's try to discuss about each part in detail. So the anatomy of ear, it is generally divided into three main regions. So one is the external ear that is responsible for collecting the sound waves, then transfers it inward. And second one is the middle ear. This will be sending the sound vibrations to the oval window. Oval window is simply the stapes muscle that is having oval window. And the third one is the internal ear, which is responsible for the hearing and equilibrium. So coming back to the first part in the ear anatomy is the external ear. So already we can see in the diagram there is a part called as auricle. So auricle is also called as the pinna. So this is simply made up of the elastic cartilage. So it is a flap. It will be looking like a flap of elastic cartilage that is mainly covered by the skin. So this auricle, it will be attaching the head with the help of ligaments and muscles. And if you see in the diagram, there is a curved tube. This portion is called as the curved tube. So this curved tube, we will be calling it as the external auditory canal. So this external auditory canal will be of 2.5 centimeter in its length. So this mainly lies in this region which is the temporal bone. This will be lying in the temporal bone. Then from here this will be leading to the this external auditory canal. It will be leading to the eardrum, which is also called as the tympanic membrane. Now what is this eardrum? So eardrum is will be also called as tympanic membrane. So this is one of the thinnest structure. So this is simply, it is the partition between the external auditory canal and the middle ear. So this eardrum or the tympanic membrane, it is the partition between the external auditory canal and the inner middle ear. So this eardrum is generally covered by the epidermis. It is simply whenever there is tearing of the eardrum, that condition we will be calling it as perforated eardrum. This will be mainly occurring due to some ear infections or because of the pressure that is obtained when you put a cotton swab inside your ear. So this can generally be examined with the help of the otoscope. So this external auditory canal, this will be having hair inside it, and it also contains certain sweat glands. Now these sweat glands are also called as ceruminous glands. So these ceruminous glands, they are responsible for secreting the earwax. So earwax is also called as cerumen. The external ear, we already said that this external auditory canal is filled with large amounts of hair and cerumen. So this hair and cerumen, it is generally useful for preventing the entry of dust and foreign particles inside it, and this will also prevent this external ear from the water and insects damage. So this cerumen, normally it gets dried up. After drying, this will be falling out of this ear canal. But what happens is, in some people, this cerumen will be released in the larger amounts. So that condition we will be calling it as the impacted cerumen. Now this impacted cerumen can be treated performing periodic ear irrigation. So it is simply washing of the ear. So this can also be removed by removal of wax that can be done through the blunt instrument, but this is performed only by the trained professional. So that is about the complete external ear. So coming back to the second part, which is the middle ear. So this area we will be calling it as a middle ear. So what happens is, this is the middle ear is one of the smallest and air filled cavity. So this middle ear is generally separated. It is generally separated from the external ear and internal ear. It is separated from the external ear through the eardrum. It is separated from the internal ear through this round window and the oval window. And in the middle ear, there are some extendings across this middle ear. So that is simply called as three smallest bones. That is, in the labeling we can see malleus, incus and the stapes. These three bones, they are the smallest bones, which all three together called as the auditory ossicles. Auditory ossicles. So this is the malleus, incus and the stapes. So what happens is, if you observe the diagram, we can easily describe this parts. So first thing is, malus is this yellow colored part. So malus will be attached to the internal surface of eardrum. So that to the internal surface of the eardrum, this malus is attached. And this head, this is the head of the malus. The head of the malus is again articulating with the incus. So the head of the malus is again attached to the incus part. Now this incus is again attached to the head of the stapes. This is the head of the stapes. So this incus is again attached to the head of the stapes. Now this stapes is again fitted into one window. That we said that oval window. That now I already said that there are two skeletal muscles present here. So one is tympani muscle and the other one is stapedius muscle, right? So these are two tiny skeletal muscles that are present in the ear, which are mainly attached to the ossicles. So first one is tympani muscle. Now let's discuss about tympani muscle. So we can also call it as the tensor tympani muscle. So normally this sensory tympani muscle, this will be preventing the damage to the inner ear from the loud noises. So the inner ear will be prevented from the loud noises with the help of this sensory tympani muscle. And this will be having the trigeminal nerve. This will be having the connection with trigeminal nerve, which is the fifth cranial nerve. And next, there is one more muscle which is called as stapedius muscle. So you can see the stapedius muscle in the diagram. So this will be having the connection with the facial nerve. So facial nerve is again the seventh cranial nerve. And this stapedius muscle, this is one of the smallest skeletal muscle in the body. The smallest skeletal muscle in the body is the stapedius muscle, and the smallest bone in the body is the stapes bone. Clear? And here there is this area. I said that this tube, it is called as the auditory tube. This auditory tube is also called as the eustachian tube. So this will be mainly connecting the middle ear to the nasopharynx. This auditory tube will be connecting the middle ear to the nasopharynx. This portion is generally closed, but it only opens in some conditions like yawning and swallowing. This will be opened. So that is about the middle ear. To understand it better, let me just zoom in this particular part. So this space, we will be calling it as utricle. This bulged ends, enlarged portions, we will be calling it as ampulla, right? And this, we will be calling it as bony labyrinth. This portion is called as bony labyrinth. And all these three, we will be calling it as the semicircular canals. Semicircular canals. So this outer part is the bony labyrinth, and this inner part we will be calling it as membranous labyrinth. In the bony labyrinth, this will be consisting of perilymph, and this membranous labyrinth, this will be having the endolymph in it. So how do you describe this inner ear? So this inner ear is mainly having two main divisions. So there are three different canals called as semicircular canals, and this semicircular canal, the outermost part, we will be calling it as the two main divisions. One is the bony labyrinth, other one is the membranous labyrinth. And this bony labyrinth will be having the perilymph in it, and this membranous labyrinth will be having endolymph in it. So just describe the structure and this inner ear will be done. So that's all about the ear anatomy. Now you have drawn the diagram. and learn the points directly from it. So, this is how the anatomy should be studied: see it, draw it, and then understand it. If this video helped you learn better, do like, share it with your friends, and subscribe to Pharma Palette to keep learning in this way. In the next video, we will take this anatomy forward and start the physiology of hearing, where we will understand how the sound waves are converted into nerve impulses. So, explained step by step, simple, exam oriented way. Until then, keep your diagrams close and your concepts clear, because at Pharma Palette, learning is about connection, not cramping. See you all in the next video, and thanks for watching.